The concept behind the chatbot was that there's a misconception that children want to speak to doctors because they just don't. But we thought maybe they will want to speak to a chatbot, because they speak to their toys, they speak to imaginary friends. Could you create something which is geared towards children that they could chat with and that would be able to ask a structured set of questions and respond appropriately? So we were thinking around the way it could be giving information, helping familiarize people with procedures, talking at a level that could be decided by the user. Like, I want it to be at this level of, reading age. I want it to be given in this way. I never even thought about the ambient scribing. And that's actually what is currently big productivity gain that we've got from this. And maybe one of the biggest actual gains we've had from technology in a short period of time with almost, with a huge amount of uptake. And people
Yeah.
really like it. So the quantum side of things, we started with scheduling because it's probably the easiest one and the data is the easiest to get when it's not as problematic to use scheduling data of a hospital. You're not using patient information. But these new types of mathematics are going to potentially make sensing so much better. You'd be able to do CT scans with an absolute fraction of the radiation because the mathematics that you use to figure out what's happened when that bit of radiation has gone through the body could be so much more advanced that over a much lower dose of radiation, you could extrapolate what's going on with that structure. In which case you could do it in real time, or you could have it done continuously through radiation. Someone even suggested, and I love this idea, was that you could potentially use gravity waves, which are totally harmless.